The House of Representatives has passed for second reading a bill for an act to authorize the issuance from the Federal Capital Territory Administration's Statutory Revenue Fund of the FCT Administration account the total sum of 1,783,823,708,392 naira only. Of this amount, the sum of 150,353,906,186 naira is allocated for personnel costs, while 343,769,677,448 naira is earmarked for overhead costs. The bill was formally read on the floor of the House by the House Leader, Honorable Julius Ihonbere.
I rise to move that the bill for an act to authorize the issue from the Federal Capital Territory Administration's Statutory Revenue Fund of the Federal Capital Territory Administration account the total sum of 1,783,828,392 naira only, of which the sum of 150,353,906,168 naira only is for personnel costs.
In a related development, the House also passed for second reading bill for an act to establish the Private Intelligence and Investigation Council. The proposed legislation seeks to create a regulatory framework to ensure professionalism, ethical conduct, and accountability among private intelligence and investigation firms. The bill was presented on the floor by its sponsor, Honorable Ahmed Satomi.
To read the bill for an establishment of Private Intelligence and Investigation Council to establish a regulatory framework that ensures professionalism, ethical conduct, and accountability of private intelligence and investigation firms, standardize the industry's practice, provide accreditation and certification, promote continuous training and development, foster collaboration between private and public security sectors, enhance the integrity and effectiveness of private intelligence and Private Intelligence and Investigation Council services.
The Non-Communicable Disease Alliance has challenged the National Assembly to support funding and policies for integrating hypertension screening, diagnosis, and management into primary healthcare centers nationwide. At an advocacy visit to the House, the group of healthcare professionals also asked for a dedicated budget line for hypertension and other non-communicable diseases.
Dedicated budget line for hypertension and non-communicable diseases, to recommit to meeting the 15% Abuja Declaration target for health sector funding with clear NCD targets, especially expansion of hypertension in the national health insurance coverage. One problem is that medications are getting more and more expensive. Most of our patients cannot afford medication. We need to register more people under the health insurance scheme. The basic healthcare provision fund has to be expanded. The community insurance, we have to do something.